That's an excellent question, and I think lots of scientists is focusing on it, and also clinicians. But it applies for all the society. It's the main problem the main reason why we should be focusing on prevention is public health. Once we prevent diseases or other healthcare problems, we prevent the costs increasing, we prevent complications. So if you prevent pressure injuries, which are mainly avoidable, that's the reason for the increasing the quality of life. Then you can save also some money, of course, if you are not focusing so much on the direct costs, because prevention in a direct cost is costly. And of course, it's also important for the quality of life of carers, because if you prevent properly some complications, people could feel better that they didn't harm other people. Oh my God, this is something what's coming, and it's very close to manly care activities. The policy which has to be in operation is that we have to reimburse prevention. We have to reimburse preventative materials. We have to help clinicians in their work if we know that something is working and they can use it, and they don't have it because of the policy decisions. You know, you don't have enough money from the economical point of view to prevent and to apply, for example, something on the skin. It doesn't matter if it's a preventative dressing or if it's some foam or something, but if it's not reimbursed, you have to pay it from the facility money, and it influences people on the lowest level. So if we look at the policymakers, we need pathways how to prevent. We need money to be able to prevent. We need the regulation for whom and when it should be done in a proper way, and we need education. So all these are at the policy level. If you imagine inpatient care, we have to always think about the acute care and long-term care. For acute care, we of course need to prevent the pressure ulcers, and it's important especially in intensive care units, because we have more and more very young premature neonates who are in risk. On the other hand, we have a lot of young people after the injuries and trauma, and we need to prevent the pressure ulcers related to medical devices. And then we have elderly people, which we always think they will develop the pressure ulcers. But this is for the acute care. So even if the pressure ulcer occurs, there is almost enough money and it looks well. There is also enough staff so far, even we are facing some shortage of nurses especially. But if we look at the long-term care, it's even worse. There are not only elderly, there are also handicapped people, and they can develop pressure ulcers or other skin injuries, which could be mixed with the pressure ulcers. So why is it important? As we already said, because of the money, because of the people, because of the quality of life of the carers and also patients or recipients of care. And if you imagine how much money you spend for the pressure ulcers when they developed, it's not just about the treatment of wound, it's about the cost of antibiotics, analgesics or some painkillers. Also, if especially elderly people are in a bad condition, if they have a dementia, there is also influence on their cognitive status when they develop pressure ulcer. So it's a comprehensive issue. So just shortly said, if you want to do something in the hospitals, you should do firstly something for the prevention. And it doesn't mean like only the skin care or the putting the patients on the proper surface and positioning. You have to change the view of people, that it's not a problem if the pressure ulcer develop. Of course, it is a problem as a whole, but still it's better to identify it early, to make early action, to treat as soon as possible, and to look after these people more than to others. If we speak about the inpatient care, we can see it a different perspective. We have an economist who is mainly focusing on the direct cost. You know, how much do I have to pay for something? Then we can see managers like head nurses or sisters at the ward, and they know that their nurses, general nurses, are overwhelmed, and there is a lot of missed care, omitted care, which is because of the shortage of nurses. If I should decide if I will do the CPR, like when I need to resuscitate the patients, I will not go into town another one, because I spend time with the patients in a vital condition or in a really critical status. And if you see it from the perspective of general nurse, for you it's important how many tasks you have to do around, and if there is something what can you help you, like wearable sensors, like tilting beds, good cushions or mattresses. The nurse wants to have all this equipment, but the economists say it's too costly. What can do the manager? So they have to be a team to achieve the goal. And very important thing is also monitoring. If we will speak just about the numbers, I mean about the incidence or prevalence in some period, or even about the point prevalence, so you will see at the unit how many pressure ulcers is in this moment, it's not enough, because you should see the case mix, what patients you have there. For example, in our country, we did a huge study about the economic burden of pressure ulcers, and we have been the first one who also included the work of nurses, the salary of nurses, the salary of nutritionists who are coming for some consultation, the salary of surgeons who are doing some debridement, because in the Czech Republic nurses are still not allowed to do the sharp debridement. So the costs increasing a lot, and we have to divide it at the ICU or critical care, standard care, and also some neonates care or pediatric units. Otherwise you will mix everything and you will never get the nice picture, or maybe not as nice, but realistic.